All right, I'd like to call to order the regularly scheduled Utility Service Board meeting of August, yes, August 1st.
Everybody's favorite month in here.
Our first item is the approval of the minutes of the previous meeting, which was July 18th. Do I have a motion for approval?
So moved.
Any questions about the minutes from our meeting? Okay. Those in favor, please say aye. Aye. Opposed? Okay. Next up, we have approval of the claims. We have 4 claims, different types. The first one is the standard invoices totaling $1,123,285.09. Any questions on the invoices? I have 2. The first one, A&M Graphics, about halfway down that first set. $39,319, the one for the Get the Let Out brochures. I'm just curious, why would that get charged to stormwater?
We are tracking the purchases all in one fund for the ARPA funds. And the big purchase was a vehicle for that. So we put that, and it will be used for the lead and then moved to stormwater. So we just decided to put it in stormwater to start with, and so everything's being charged there. Once we get reimbursed, it'll go into water.
Got you. Thank you.
We'll move everything.
Thank you. That makes sense. Okay, and the second one is on Smith Design Group for the review of the neighborhood stormwater, residential stormwater grant projects. And so when I was working on this in its first 2 years, we didn't have that outside review done. So I was just wondering about the basis and the need for that outside review.
That was decided last year in the 2022 budget process that we would do that in order to bring more equity to the program, because what we discovered is people who had more wherewithal were able to go hire an engineer to help them with their design, but other people could not. So what we saw was a large disparity in the quality, completeness, and overall presentation of design. So we're trying. The decision was made last year during budget process to underwrite some of those activities to help make the program more equitable.
That does sound familiar now. Thank you. Any other questions? We need a motion.
So moved.
All in favor, please say aye. Aye. Opposed? Next up, we have utility bills totaling $16,791.57. Do we have a motion for approval?
So moved.
Any questions? All in favor, please say aye. Aye. All opposed? Next up, we have wire transfers totaling $372,836.38. Do we have a motion for approval?
So moved.
Any questions? All in favor, please say aye. Aye. Opposed? And then finally, customer refunds totaling $1,814.71. Any questions on the customer refunds? Yes.
Is it supposed to be Weddle Brothers? Okay. Just,
It wasn't, the check was made out.
okay, just wanted to make sure. Thank you.
Any other questions? Do we have a motion for approval?
Wait. So moved. Second, sorry.
That's fine.
I was just sitting here laughing of how I would say that. Would keep, sorry.
That's okay. It's good to, humor's good. Okay, all in favor, please say aye.
Aye.
Opposed? All right, next up we have the consent agenda. Vic Kelson.
Good evening, Vic Kelson, Utility Director. I'm here to present the consent agenda, which totals $58,800. Item A is Klaus Inspection Services LLC for $12,000. This was backwash tank repair at Dillman. And Greeley and Hanson is item B, $24,300. This is phase 2 of developing a capital improvements plan for Dillman. And then item C is Eagle Ridge Civil Engineering Services LLC. This is $22,500. It's the first amendment to the downtown culvert modeling extension. We're extending the distance downstream that model covers. Would anyone like to consider any of these individually? Hearing none, if there's no opposition, the consent agenda will be approved as recommended by staff. Hearing no opposition, the consent agenda is approved. Thank you.
Thank you. Our next item is a request for approval of an agreement with Verily Life Sciences LLC about COVID wastewater sampling program. James Hall.
Hi, James Hall, AD Environmental Programs. This is a contract with Verily. They are actually going to pay us $150 for every COVID sample that we collect and send to them. They're looking for certain size treatment plants, and knowing building qualified, I reached out to the task about Blucher since we were already collecting samples at there. But they will pay us $150 per sample that we collect. They're part of a national program type wastewater scan, sewer, coronavirus. Alert system. Or alert network. Sorry. So anyway, is there any questions?
Where does the money go?
I'm guessing we'll put it in our wastewater fund. I don't know. I mean, to recruit our time and energy. They're going to provide all the bottles, the shipping containers, the prepaid shipping boxes to send back. Basically, all we have to do, we're paying us for our time to collect them. We're already collecting them multiple times a week, so either through the CDC program or of our own sampling. So it's not a big ask of our team to do anyway. So.
Will we be able to have access to the data collected?
I believe so, right, Chris? That was part of that, yes. That was part of the contract negotiation, yeah, so we will.
And do we know how long, is this a grant, or this is not a grant, but I mean, in terms of their project, do they have a timeline on this? And
They haven't told us. I know in the contract it's for 12 months and then a possibility of renewing for 12 months, so I don't know if they have some grant money available and they're just not sure how long that will last or if they'll get it renewed or not, so.
sounds great, thank
Yeah.
you.
James, any idea what program or how they're going to use this? Are they just looking at COVID, or is it other things? I'm kind of interested because it will add Bloomington to some sort of national study or database, and
Yeah.
hopefully that's a good thing.
Yeah, so the email that we got, and we haven't directly spoken with them, but it says a national program called SCAN, Sewer Coronavirus Alert Network. So I'm assuming they're only looking at SARS-CoV-2 there, but yeah, that's what I have so far. So
My guess is then we'd be sending it, and it would probably be a lot like the system we've got going on now. Where
Correct, the
it goes away, we don't
NWSS.
get results for all that lag time of transport and processing and all that.
correct.
But it's good that we're going to participate.
Yeah, and the NWSS program, is that the correct acronym? That program is ran through the CCC. We've been getting the results back quicker, much quicker now, so once it's gotten running. So hopefully it'll be the same way with these as well.
Good, thank you.
So we talked about working with an IU professor as well. This is separate.
Correct.
And okay, and the timeliness, we don't anticipate it being any more timely than the turnaround we get now?
No.
And does this alleviate the need for any of the sampling that we're doing now? Will we stop anything because we're doing this?
No.
No. Do we give up any rights in terms of the data usage and its publication? Do we they use this data however they want to.
Give up any rights. So what rights would we be giving?
The published values of the COVID levels in our wastewater?
You want to write a paper, Joe?
No, I didn't, no, like if we decided we didn't want that published for any reason, do we have the right to say, you can't use it?
No, we don't have any authority or right to make objection to how they're gonna use the samples once they receive them. That's entirely their, once we put the samples into the stream of commerce, so to speak, they become something that is their once it gets to them, it's their responsibility to have it, handle it, use it the way they wish to, and publish whatever it is they determine from the findings.
Okay, and we see any potential problems with that in the future at all, or we're not?
Not from my perspective, no.
Okay, thought I should ask. Those are all my questions. Any other questions?
I have just a comment. I think it would be interesting, and you may already know this from other sources of data collection, but when they're gonna collect for this and when we collect for another thing, is it, like I've taken the same source of water at the same time, so that you can directly compare what does this company get versus this company and see, how
Correct.
that.
So the way that we do it is, at each one of the wastewater treatment plants, there is a auto sampler at the influent where the water's coming in, and it's sampling every hour for 24 hours. That container gets taken into the lab at each one of the plants, and then my team goes out and takes from that same container and dumps into whatever bottles we're filling at the time. So it is all collected in one large container and then put into that. It's not over a separate time or from different bottles. It's one large one that gets used for all the same sample collections.
So essentially the data from that
Should
should
be.
be the same as data that we're collecting in.
It should be, but it's very method specific and how they concentrate it. That's why some of those CDC number, the NWSS program we're in is very different than the other program that we were using. It's just because of how they're concentrating the samples and using it.
Okay,
So,
thank you.
Would anyone like to afford a motion to approve this agreement?
So moved?
All in favor, please say aye. Aye. Opposed? All right,
thank you.
thank you. Next up, we have request for approval of an agreement with Electric Plus, Inc. for an S1 circuit feeder wire replacement at Dillman Wastewater Treatment Plant for the amount of $55,545. Vic Kelson.
This is actually an item that closes the books on an emergency contract that has already been completed. This was one of the feed wires at the Dillman plant that goes from the pump station that is the head of the plant where the lift pumps are to the polymer building transformer. It's not a real long wire, but that wire shorted out completely, which disabled the mixers at the EQ basin and all the power up there as well. So it was very disruptive to the operations. We did an emergency agreement through the controller's office, and now this is that contract being formally approved.
Any questions for Vic? Do you have a motion? All in favor, please say aye. Aye. Opposed? Thank you. And finally, and before we go on to old business, we have a request for approval of an agreement with WYN Industries, Inc. for a sodium hypochlorite tank repair at Monroe Water Treatment Plant for an amount of $126,170. Again, Vic Kelson.
So this is a contract that's related to leaking chemical storage tanks at the Monroe plant. It's actually more than one tank that's going to be repaired. The first is a sodium hypochlorite bulk tank. That's a storage tank. We have two of those, number one and number two. Both of those tanks actually have some leaks, but number two is in worse condition. We can't repair them both at once because we need to use chlorine in the plant. So we're doing tank number two, and then later we'll do tank number one. The fluoride storage bulk tank and the fluoride day tank, those are both highly acidic materials, and we're going to repair those 2 tanks as well.
Questions, Jim?
Just wondering, how much does a new tank cost as opposed to repairing?
A lot more
A lot more.
than it would be to do these repairs, yeah.
I have no clue about
Yeah,
the cost of.
yeah, replacing these tanks would be very costly, yep. And they can be repaired. The vendors looked at them and said that they were repairable.
Any other questions? Do we have a motion?
So moved.
All in favor, please say aye. Aye. Opposed? Thank you. On to old business. Any old business from the board? Old business from staff? New business from the board? New business from staff?
Yes. I'd like to talk some about Justin is here. Hi. I'd like to introduce Justin Greaves. He's a professor at Indiana University. His lab is the one that has the apparatus for doing virus scanning of wastewaters. We've been meeting with him and representatives from IU Health, and the Monroe County Health Department to look at the prospects of doing a community-wide, more comprehensive sampling program for COVID and other viruses. So it would be SARS-CoV-2. I think we've been talking in general about influenza and monkeypox as well. So the Dr. Greaves has provided us estimates of what it would cost per year to do different numbers of samples each week. And what we would hope to do is have all the interested parties, that would be the 4 interested parties, all contribute to that effort, and CBU would do the in-kind effort of collecting the samples and taking them to the lab. We'd be able to get faster turnaround on the results as well. So I wanted to introduce you to Dr. Greaves, and we're happy to entertain any questions. And I know Kirk's got a few things to say about this too. So.
Welcome, glad you were able to come. When you sample for COVID, are you able to determine the variant?
Yes, I can also do that.
Introduce yourself for the record.
I'm Justin Greaves. I'm a new professor at IU. And for the variant, yes, I can do that. It's you'd have to sequence a sample. It depends on what type of variant you're looking for. But yes,
That
I
would
have
be
capabilities.
interesting to know as well as the amounts.
Yeah.
So we hope to see you back here with some data.
Yeah. Love to work with you guys. Any more questions?
Other questions?
Sure, I'll make some comments. We've had, as Vic mentioned, some meetings to discuss about how this might all work, and the very encouraging thing is that we've got the same kind of cooperation, I think, that we've had with different government and IU Health and other parties through COVID, continuing on with this discussion. And so far, everyone is very positive about their ability to contribute financially to doing the sampling here locally, which, as we've talked about, will allow us to have faster results. And what I've learned in all this is we're to that point in COVID where we're not institutionally testing as much. And if we want to know when an outbreak is going to be happening, or how far along it is, where it is, we can't really depend on the healthcare system, because now everyone is doing the home tests and it doesn't get reported. So it's really hard to tell the concentration of a disease prevalence in your community. But wastewater doesn't lie, right, Dr. Greaves?
Yeah, absolutely. It captures both asymptomatic, symptomatic cases, everything.
Yeah, and so the costs are comparable to what we're paying to send it away, to do it locally. And if, that's, I think you gave us an estimate of about 4 samples and then another one for 8, if I'm not mistaken. The unit price goes down the more we have. So the more participation we have, the better.
Absolutely, yes.
And VIX also reached out to the county plants that are run by Bynum Faneuil, asking for their interest as well. I'm not sure we've heard.
Haven't heard anything definitive yet.
Back yet. IU Health is interested in contributing, and our new county health director is also checking county resources and discussing with the commissioners whether the health department can contribute to the solution as well. So I think this would be a great thing for community public health, taking advantage of resource we have here locally, and it'd be a great thing. We're making progress.
Yeah, absolutely. I mean, I even think not just for COVID, it would be great for, you know, other viruses, especially monkey virus, which, you know, monkeypox virus, which I'm told is probably already here. Someone said there's a couple cases here, so it would be great to test waters for that, test the wastewater for that, so that we can, you know, act before it starts to grow and spread more.
Also, I think, you know, as we have influenza outbreaks, you could figure out whether it's flu A, flu B, what it is, much faster than us trying to compile that by all the health providers in the community, which would really help with the kind of treatment you provide and things like that. So this has got some really positive aspects.
Absolutely.
Professor, I have a question. Are you collaborating with any other universities or other cities on this work, or is this strictly something that you're doing here in Bloomington?
Yeah, so I did reach out to the folks in Chicago. They have like a statewide system, and also in Kentucky they have a system there, and I'm hoping to collaborate with them. It depends. I don't know how, their funds are usually local, comes from the local government, but yeah, I'm planning to work with them, and hopefully we can include some of the Indianapolis and other samples from around this area. I'm always happy to work with anyone.
Good luck with your work.
Thank you.
You know, Dr. Rees, I wanted to ask one more thing about how this might contribute to the bigger base of knowledge for infectious disease by being able to study in research that you might be undertaking, how you might be able to use this to study trends, so that it kind of adds to the body of knowledge that we have about some of these diseases.
That's a good question. There's a lot of work that has been done on this issue. I think one of the main things that came out of this whole pandemic with measuring COVID in wastewater is the fact that we're able to see the peaks before hospitalizations. And I think we've been able to improve that, see, and then try and understand what the prevalence in the community is. And that's something that I wish to continue doing. Hopefully we can understand when we get a certain amount of concentration of COVID in the wastewater sample, maybe we can tell what an amount of population that has it. And then also by sampling from different areas, we can tell which regions have it. And so that's a big area of research that I hope to expand upon in this.
Well, welcome to Bloomington. Been here about a month, right?
Yeah. And it's a wonderful city. I've enjoyed it so far.
Public health, yeah.
And yeah, any other questions, you can always email me. I'm always open to talking with everyone.
Based on Kirk's comment, I'd like to suggest a slogan for CBU: wastewater don't lie.
Oh, no. This is bound to turn into some Big Brother conspiracy. Good God.
Thank you for coming, Professor Greaves.
Absolutely. And if I wasn't clear with anything, you can always email me, as I said. Yeah. Just thank you.
Vic, are we still sampling at sites around the city or just at the plant?
Just at the plants.
Okay.
Yeah.
Thank you.
Yeah, if we embark on a larger program, we could look at other locations as well, but that hasn't been determined yet.
Thank you. Any other new business?
Not from staff.
Okay. Subcommittee reports. We did have a subcommittee, property and planning subcommittee prior to this meeting. Amanda
Yes.
Dunham.
And we, the board has received this, a very healthy packet regarding the Winston Thomas Master Plan. We are, as the committee, we are starting the conversations on what it would look like to potentially build a new location for the service center and the garages. And I will pass it to Vic if he'd like to share a little bit more about the project and where we are.
So the master plan outlines some conceptual ideas for how a new site could be laid out. Presently, CBU is bursting at the seams, both in the garage and also in the service center. We also have a lot of materials that we don't have appropriate covered storage for. So the master plan addresses all of those, and with an eye towards the future of the possible and likely growth of CVU over time. There's room at the site for us to do that. The site is already owned by the city and was a wastewater plant for a long time. So it's kind of a coming home kind of notion, I guess, as well. At this point, the master plan was completed 2 years ago now. When we embarked on that master planning process, one of the questions from the board was the question of, we were 6 months into COVID at that point, and the question was, what is work going to look like in the future? And here we are 2 years later, and we're all here at work. So the notion that we're probably going to have an empty building for an indefinite period of time is has not proven out. So where we are right now is we're looking, based on a discussion with the board, there's sort of two tracks. One is to look at the finances, one is to look at design and costs. And then after we've gone through that, we can put some better numbers together. We would pursue getting a design architect and engineer to look at all the things we'd have to do to redevelop that site. And this is an ongoing process. We have to look at how it would be funded and financed and how it works together with rate cases and all that sort of thing. So there's a lot of moving parts. I do encourage the members who weren't here for the subcommittee meeting to take a look at the plan. It was discovered during the meeting by Jeff that some of the large plates did not print properly. So we will work on getting better copies of those, but they are complete in the PDF document. So if you look at them on your computer, you can see them nice and big. So I'm happy to answer any questions about that. We're really not making decisions at this point. This was the beginning of a conversation.
Is there a timeline?
We would like to move on it as quickly as we can, with the understanding that that it is a complicated project. So, certainly the administration downtown would like us to move as quickly as it's possible for us to make decisions about it.
Other questions? Okay. Thank you. Let's see. We go into staff reports now, correct?
Me again. The big thing is we are nearing we are now in August, so it's budget month. We will be in front of council on the 30th. The next meeting of the USB is on the 15th, and then there's one on the 29th. We don't like the idea of bringing the budget presentation on the day before the hearing, so we will be bringing our budget presentation to the board in 2 weeks' time on the 15th. I was going to seek guidance. Do we want to do the full presentation to the Finance Subcommittee and have board members attend the subcommittee meeting, or do we want to just bring it in one big chunk to the board? I think it would probably be most effective to have a subcommittee meeting at perhaps at 4 o'clock. We can go through the whole presentation at that time, and then either an abbreviated presentation or a discussion during the meeting. Whichever way you want to do it. So I'll leave that up to the chair and vice chair to figure out how you want to proceed. But we would like to bring it to you on the 15th. So,
While we're here, does anyone have any strong opinion about handling that one way or the other?
Having attended them before, I like the idea of the full presentation to the subcommittee, because then you get questions from the subcommittee, and then a somewhat abbreviated presentation to the rest of the board. I think that's worked very well in the past.
okay. And usually we've done that on different weeks, but because of the way the calendar lines up this year, it's pretty
Yeah.
difficult to do that. We would have to schedule a subcommittee meeting on another Monday, which makes it difficult. The board would not have to take final action on the 15th, although you probably would. But there was a time a few years ago, we did the full presentation of the subcommittee, and then we did the full presentation of the board, and people thought that was a little much. So if we can schedule it that way, that's how we'd like to do it.
So should we plan on a subcommittee meeting at 4 o'clock on the 15th?
I think that's right. Is that what we were talking about? Yeah, subcommittee at 4 o'clock on the 15th.
And when do you anticipate having the documents to us?
We'll have them to you with the packet for that meeting, if not before.
Okay.
Yeah, so having the abbreviated version afterward would be appropriate if we're going to do the full at
Excellent.
4.
Great, thank you.
All right, good? Okay. Please.
And we are still continuing trying to fill vacancies. We actually have a few more new vacancies, a couple new ones in T&D, but we're working with HR to fill vacancies as quickly as we can.
Is that it for
That's all I
staff
have.
reports?
I'm sorry, that's all I have.
Okay. Then we just have petitions, and unless there's any questions about the staff report. Okay, petitions and communications from anyone? Okay, a motion for adjournment, please.
So moved.
We are adjourned. Thank you.